we're listening to all these people saying that, okay, cardio is not so important once you go into perimenopause. It's all about lifting and lifting heavy and becoming stronger. How important is it to lift weights? How does it affect our bone loss? Like, how does this come into play with protecting our health?
There's a lot of studies that are out there that says, well, once you start hitting perimenopause, menopause, and you have your estrogen hormone that's going down, you have a significant reduction of your bone mineral density. It actually happens a little earlier than that. There are studies out there that are showing near your mid-30s that we're already starting to have this small decrease in the density of our bones. Now, the reason as we get older that weightlifting becomes more important is because there's a lot of things. Again, it's not just as simple as saying this to this to this. There's a lot of different outlets that are affecting the health of our bones, whether it's hormonal, whether it's something medical that you're going through, but it's also the exercise, the activities. After a certain point, when we hit menopause, perimenopause, and menopause, you have that significant decrease in the density of your bone because, yes, a huge component is the estrogen hormone. So how do we maintain the health of our bones? There's other factors, which is, yes, the weightlifting, but you definitely don't want to ignore the cardiovascular, because if you completely ignore cardiovascular, then you won't be able to optimize your weightlifting part. You'll get fatigue a lot sooner, or you might not have proper balance and strength to make sure you don't injure yourself. So you do want to continue the cardiovascular exercise. You just want to implement more the strength training exercise.